Hi, I'm Margaret Larson. Welcome to a Facebook Live conversation with Dr. Kevin Wang and registered nurse Connor Wesley from Swedish. And we're talking about LGBTQ Health Awareness Week. And let's just start with the basics. Why we need an Awareness Week? What are some of the issues that we need to pay more close attention to?
Well, that is a really huge question just because we don't have a lot of data in terms of the LGBTQ community. If you look at community health needs assessments, the areas that we typically fall under will usually be STDs and drug use and HIV.
But that obviously doesn't encompass
Whole
life for this whole population.
Absolutely. And so there are areas such as mental health, diabetes, cancer screenings. There's so much information that we don't know about the community. And the studies that we do have really do show that people just don't feel comfortable going to a clinic where they don't feel welcome.
Yeah. Well, this may be the kind of basis of it, right? You want to go places where you see yourself reflected and you know you'll be safe and you know that you'll be recognized. So as part of the work at Swedish to make that so that people have health equity.
Absolutely. And I think it really started with the people, the employees, and hearing our friends and patients who go to Swedish. And we really realize that there's a lot of work that has to be done. Swedish is certainly doing it. There are ways that we could certainly be doing better. Yeah. There are things that Connor has been doing.
Yeah, we are really lucky to work for an organization that wants to hear our input. That when I went to some of the head up nursing and executives and said, I see an issue, I am concerned, I want to make a change, and they were like, yes, let's do it.
Well, let's talk about what concerns you saw first of all.
So for me, on the nursing end of things, we spend most of our time with our patients.
Nurses are the best.
More than doctors, to say.
Yeah, I mean, we are the ones that people see when they go to the hospital, and so I saw some things in charting and the way people didn't understand the language and how to speak about their patients and how to do it respectfully, that I realized that we are very much lacking in the education to take care of particularly the trans community, but also the GLBTQ.
So you brought that before the people who head up the nursing department and the other medical professionals, and what kinds of things have you done to respond to it?
So we recently last month had Nursing Grand Rounds where I got to be the keynote speaker that was just specific to GLBTQ health, which was phenomenal. We had a great turnout. It was broadcast to a couple of our other campuses as well, so it was great.
That's awesome, and we don't know what we don't know, right?
Right,
exactly.
Right. And then prior to that, I think I'd given 4 or 5 other lectures. In nursing, we always have these nursing symposiums that we have to go to twice a year, and so every nurse has to go, so it's nice to be able to catch them while they're somewhere they have to be.
And make sure that they hear this. Give me a couple of examples of things that you presented to people that maybe they hadn't encountered before.
So what I really focus on is providing nurses with the tools to make their patients feel safe. So it really is asking what their pronouns are, asking if they have a name that they prefer to be called. And many people have names that they prefer to be called. Most people that go by William prefer Bill. So it's not unusual for us to use nicknames for people. So it shouldn't be unusual to use a different name for a patient other than their legal name at the time.
And as a mark of respect.
Right, it is a mark of respect, and it is like waving a white flag. If you ask me what my pronoun is, that is that white flag that says I'm a safe person for you to talk to.
Because I'm just aware enough to be open.
Right, exactly. I'm aware enough to know that your pronouns might be different than the signals you're giving off. Because we gender people instantly when we see them. And it's just ingrained in our minds that.
Well, it is, and I think a lot of people are willing to change if they know what it is that they're supposed to be looking for. So it seems to me like a great favor that you're offering us to say, hey, here's a way to make sure everybody feels included and welcome. And I know, I would want to do that, and I presume most people would.
Yes.
So you have been open to tell us that you are a transgender person.
Yes.
And you have to have health care like everybody else.
I do. Yes.
So you know whereof you speak. What is the difference, do you think, in health outcomes for people who will feel comfortable to come to a doctor when they need to, or a nurse?
So a lot of the health disparities we look at are what causes people to not go to the doctor.
Because we want to eliminate those.
Right, because we see that by not going to the doctor, preventable conditions aren't being treated until they become chronic.
Right.
And
So then you have an emergency.
right, so
on
then
your
you have a
hands.
big thing to deal with instead of something that could have been managed easily. But so it's fear of things like being misgendered. When you call to schedule an appointment, if they say ma'am or sir and it's not how you identify, it can be very emotionally distressing. It's, gendered waiting rooms. It's how we call patients back. Do we call them back by Mr. Wesley or Miss Wesley, or how do we call them back to the into their rooms? And for inpatient in the hospital, how do we decide which room they go into? Most hospitals have double rooms still. So who's going to be their roommate? And
Right.
so there's all of these fears that keep people from going. And so the more open we can be about how we want to respect our patients and who they are, ideally the more safe they will feel.
Tell me if I'm right about this, because it's just my theory that the world is made for cisgendered people, for
Yes.
people who are a lot of things, and so it's comfortable for us to navigate. But then every degree of different you are from whatever that norm
Yes.
is an extra degree of difficulty
Yes.
in your life across the
Yeah.
board. And so one of the things I see you aiming for is to give us a more level playing field. Do I
Yeah.
have that
Yes.
roughly correct?
Yes. We see a lot of this unconscious bias in every aspect of life. We all have these sort of unconscious bias. And in healthcare, that unconscious bias is that we assume that you are straight until proven otherwise. And so...
Which leaves you as the patient in
Right.
the position of having to say, oh, wait a minute,
Right.
here's what's
Actually,
going on.
you're wrong. And so every
Yeah.
time you go to a new provider, you have to come out. And every time you come out, there's a fear of rejection. And when you are accessing healthcare, you are already in a very vulnerable state. Nobody goes to the doctor when they feel good. Well, hopefully they go for their yearly
Yeah,
physicals.
but otherwise not.
Otherwise, we are going to the doctor because we don't feel good. And so emotionally, we are in a different place, and that place is of vulnerability.
It's such a good point, and honestly, you're opening my mind because I hadn't thought about the difference between you as a patient having to assert, no, I'm different than your assumption, as opposed to the doctor just saying, what's up? And you being able to answer
Yeah.
and be included in the various categories that they may be dealing with in their head. Are there things, I know in terms of when we talk about degrees of difficulty for people and the added stress that they may be experiencing in their lives, there are often mental health components to that. How is that taken into account when you're dealing with the LGBTQ community? Or with minorities or special categories of people in any case?
Yeah, I think
Because it applies to women, I know as well.
it really just applies to any vulnerable population, right? And so when you start looking at different points of intersectionality of someone has an identity and people can have identities within identities, those are things that, again, it all just comes back down to education and knowing what people are at risk for. And so when you already have somebody who is impacted by having or who isn't able to access certain social determinants of health. So it's not just access to insurance, but it's also being able to have a place to live, having food and water security, being able to get access to good education or even employment. And so knowing all those things and how it can impact the health, mental health and physical health of a vulnerable population, such as the LGBTQ community, I think being aware of that's going to be really important.
And particularly for young people, right?
Yes.
Because there are young people who may not be, as tragic as it is, welcome at home or dealing with things that might not ever cross our minds if we weren't more aware.
Yeah, 40% of homeless youth identify as LGBTQ.
Wow. That is amazing. So that is a really important point of outreach for healthcare. Are there other examples? Not any names, obviously. We know there are HIPAA requirements here, but can you give us an example of a patient who might have slipped through the cracks, if not for a more welcoming environment?
So I'm going to kind of maybe take more of a positive spin on it. So one of the ways that I introduce myself to new patients is, hi, my name is Kevin Wang. I use he, him, his pronouns. It's nice to meet you. And one way of making sure that people don't slip through the cracks is sort of opening that door to allow people to walk through it. One example that I have, actually two examples, and it's really one of my favorites, which is in Chinese, there's really no way of differentiating between the masculine and the feminine. So there's no he, him, or she, her. So when I introduce myself to my patient, I say, hi, my name is Kevin Wang. I'll be taking care of you today. I am a gay provider. And by opening that door, I had 2 elderly Chinese people who came out to me, who are
my
married with
gosh.
children. And one of them just started sobbing because that person would just said, I have never had anybody say that to me. And this person is engaging in maybe some higher risk sexual behaviors, and being able to catch that person and to be able to make sure that appropriate screening is done, that we're putting them on appropriate medication to prevent HIV transmission and acquisition. Those are things that we really should be focusing on to make sure people don't fall through those cracks.
Oh, and you just taught me something else there. So by you volunteering this information, that is an entirely different thing than just asking somebody a question that they might not want to say.
Yeah, and I think that's
The
one
answer
of the,
to.
I think that's one of the things that, that us in the healthcare profession, it's a two-way communication street. They are telling us things that are very personal.
Yes, and it's a big deal.
Yeah.
It is a big deal, and I feel as it's I should be sharing something about myself with them because they want to know about me just as much as I want to know about them. Do they feel that I'm going to be a good fit for that person?
That is an awesome thing, and that sort of comfort all the way around. I mean, even if it's just, we were talking today about colon health and women often feeling more comfortable just to go to a female doctor. I mean, that whole sense, as you mentioned, Connor, of vulnerability is not to be poo-pooed. That's a big deal.
No, and that is a huge thing. In nursing, that is one of the things we pride ourselves on, is making our patients feel safe.
Absolutely. We think sometimes because Transparent is on the air and, you know, Will and Grace had a reboot and all of this, that, oh, everything's fine, you know, there's no problem out there. But in fact, there are still obviously huge pockets of resistance or unwelcomeness or unawareness, and breaking that down in your field is, I think, a good example for all of the rest of us. Can you kind of talk to me a little bit about what maybe the average person could think of in terms of the way we go about talking to and greeting people or thinking about things that would be barrier lowering?
Well, I think for me, I mean,
So it sounds like you've learned some things here.
I mean, Connor and I have been talking a lot about education, but I think it goes back to what you said, which is knowing what you don't know.
Yeah.
And particularly when it comes to implicit bias or the unconscious bias, that because we've been barraged, at least when I was younger, by heteronormative, cisgender, sort of having all the information given to us.
Which is invisible to me, right?
Yes.
Because that's the world I live in.
Well,
So I'm
right.
glad to know this about you.
Well, it's invisible to me too, right? So Harvard University has a test called the implicit association test, and knowing what you don't know, that test really helps you figure it out. There's one that does for to see if you have bias towards heterosexual folks versus gay folks, and interestingly, no matter how many times I took that test, I always bias towards the heterosexual community.
Really?
And
So
I-
is this a test that's open to anybody?
It
Is it
free,
online?
It is online.
Okay,
They
you have
it
to
for
tell us
race.
about that
It's
after this conversation, and
phenomenal,
we'll
but-
put it up for people to do it, because I think it's not, you know, sometimes people think that if they're being corrected or taught something that means that you're being put down, but no, it's okay. If you don't know what you don't know, that's all right. It's
Yeah,
just
and
a
it's-
willingness
it's-
to learn something new.
It's not until that moment where you go, oh, I have no idea what they're
Yeah.
talking about, that
Right.
you usually realize that I don't know this. And so, you know.
But I'd like to know it
exactly,
because
and
I want
that's
to be
the-
able to talk
and
to
that's
everybody.
the hope, is that people get to that point of going, I'd like to understand. I want to understand your struggle and your journey, because we all have a struggle and a journey. It's just different.
Right, but you are so right, and I think we can learn a bunch from this. So in terms of parenting, let's say we have a child who has gender questions or orientation that has to be dealt with, and you know that you need to be an advocate for that child. What's the best way to do that within the healthcare community?
I think making sure you have a really great relationship with a healthcare provider, whether it's a nurse practitioner, whether it's a MD or DO, whether it's a nurse midwife, somebody who takes care of the entire family. I'm a little bit biased because I'm a family medicine provider, but I think having that support structure there is really important.
And
But
if you
also,
don't have it, move on, correct?
if you don't have it,
Yes.
you find somebody
Yes.
else. Absolutely.
All right. Talk to me a bit about primary care as it's changed, because I think we got into this thing for many years where you went to the eye doctor for your eyes and the ear doctor for your ears, and blah, blah, blah. And we sort of forgot about the primary care doctor as the person who's interested in all of you, oversees everything that you do, and is really open to any area of your life that you want to talk about.
I mean, I personally love primary care, but again, I'm a family medicine provider. But I think this year certainly marked an increase in medical students who want to go into family medicine, internal medicine, OBGYN, and pediatrics. The part that I think is going to be really key is it's great that we're talking with people who already have their licenses and who are currently in practice. I think the next stage is really focusing on getting this training out to medical students, getting this information out in terms of knowing what, or trying to figure out what you don't know
Right.
early on in college, high school, middle school. This
And
is really
start to
reaching out.
absorb that. And I've got to believe that has a huge amount of impact on the results and the outcomes. The patients you mentioned, if they hadn't told you the behaviors they were engaged in, how would you ever intervene? And if you don't make that possible, then that person goes essentially without care.
Yeah. A recent study I read looked at the number of hours that medical schools spend on talking about GLBTQ health, and it was found that most of them don't spend any time. And so,
Seriously?
Yeah.
75% rated their LGBTQ training as fair or poor in a 2011 survey.
Yeah.
So this is
So
an
it
area
is-
we need to get
yeah,
better at.
Yes.
Our community is not talked about in medical schools. I've been lucky. I went to Seattle University for my nursing degree, and when I was a student said, we're lacking in this area and I would like to help. And so as a student, I started lecturing for nursing cohorts that were coming behind me, and I still get to lecture and share that information with students. So there's some areas where we get to, we get that into the education, but there's a lot of areas where it doesn't occur.
Right. Well, so I'm concerned about how we bridge the gap in the
Right.
meantime.
Yeah.
Obviously, we'd like every provider to be totally open-minded and well-informed about this, and we would wish everybody would be super well-informed on their
Yeah.
own and assertive about their own care. But one thing that occurs to me is the wisdom of maybe taking somebody with you if you feel
Yes.
uncertain, so that you've got somebody else you're comfortable with who can help speak up for you. Is
Yeah.
that allowed in a primary care physician's office?
Absolutely. I think, and both of us really feel that having somebody with you to advocate for you is really fantastic.
Yeah.
It's just, unfortunately, some people feel very alone. They don't have a support structure when
Yeah.
they move out here. I've had a number of people somehow find my work email address and email me saying, I just moved here because I had to get away from someplace. I don't have anybody here. What sort of, I want to seek out care. And part of our job as nurses, as as physician assistants, as providers, our job is not only to help protect their emotional, physical well-being, but really to help them get set up with support structures outside of
Right.
out of our office.
Which we all need. And
Yes.
we kind of take it for granted if we have it, but if you don't have it, it's a big
Yeah.
deal. That's so interesting. I really appreciate, most of the time when we have these awareness weeks, we're not really sure why they're there. We're sort of generally raise awareness, but this seems to me like this is life and death,
Yes.
healthcare outcomes that are good or bad, people
Yeah.
who are living their best lives or who really aren't. And medical care is something that we all need, and we all want it to be the highest quality and the most comfortable. So thank you both for being willing to talk to us about this and kind of helping us expand our awareness.
Is there any chance I may just do one plug, if that's
You do
okay?
it.
So for any providers out there who want to learn how to provide care for the trans population, Swedish is having a continuing medical education conference for providers out there, and you can register at swedish.org and go under health professionals and go to the CME section. It is April 13th and 14th, and it is focusing exclusively on trans health.
That is awesome. Anything you want to add, Connor?
I would add, there's a lot of stigma around being transgender. And when I first came out, it was terrifying. And so I tucked that package neatly away inside and left it there for 9 years. But what it took for me is learning to love myself enough to realize that I had to be authentic and I had to live this life. We are often stigmatized in a lot of ways, but it really takes a lot of love from the people around you and from yourself to be able to live authentically, and I hope that everybody can find the way to do that.
Well, thank you for putting that forward, because I'm a big believer that when we know better, we can do better.
Yeah.
And this is all part of that package. Thank you so much. That wraps up our discussion. Thank you for joining us, and we'll see you tomorrow on New Day. Thank you both very much.
Thank you so much.
Appreciate it.
Yes.